Hey, welcome to Body Talk. Here with Sherry Russell, nurse practitioner. And today we've got a subject that should be very important to everyone.
Absolutely.
This does not discriminate.
No, it touches every family, I think, that I know. They know someone or they have someone in their family, I'm sure, that is affected. And we're talking about drug and alcohol addiction in our area. And today we're going to have Trisha Gibson with us, who is Forensic Program Director for Drug and Alcohol with Woodland Centers, who have facilities in Jackson, Gallia, Meigs, and I believe they do some stuff in Benton County as well. But it definitely affects every family.
So we're talking about everything from drugs to alcohol.
Yes, and I think we're in the middle of such a huge epidemic currently. And this area is just prime for it. I think Scioto County has the #1 overdose rates in the state of Ohio, I believe, and I think Gallia and Jackson County are in the top
Close.
5, 10, and through there somewhere. But it's rampant. It has been going on for years, but it has finally just came to the point where, communities just have to rally together, and everyone is trying to find ways to end this and treat this. And
Because the main question I imagine everybody struggles with is the fact that I don't think you can arrest people away from it. You can't use law enforcement to stop it. You may be able to stop some of the supply or whatever, but as far as being addicted to something, it's not, making things illegal and arresting people is not going to do it. So what is it that will keep people from doing these sort of things? Harming themselves. I mean, you look on the internet and you see these people and before and after, and it's like, why would you do that to yourself?
It does, and it takes over their lives. It destroys their lives. They don't care about their families. They don't care about their children. They don't care about their jobs. And this is a very expensive habit for people, and the money's got to come from somewhere. And therefore, we're seeing a rise in theft. I talk to people that I treat every day, and they're saying that they're spending, $100 to $200 a day on heroin.
Yeah, I don't have that.
Yeah, whether they're shooting it, and
they don't have a better job
and these
than
are
me.
people without jobs.
Right.
So the money's coming from somewhere. But those are some of the things we're exploring today. I wish we could come up with an answer.
Yeah, this is what you need to do.
Yeah, this is what you need to do. It'd be great if there was a step-by-step thing. But it is a huge nationwide epidemic.
And what some of the Nordic type countries are doing with it is they decriminalize it, make it legal, and then go in from that direction, with the needles and, trying to help them and then counsel them back from it.
And it's a multifaceted approach, and it's going to take everyone working together. It's law enforcement, they're absolutely covered up. This is, it's taking all their resources. People overdosing, and people are using all their budgets on Narcan to revive these people that are overdosed.
And there's a question of how many times should you do that?
Absolutely, and that's very controversial also. If it were your child laying there, absolutely, you would want somebody to use Narcan and bring them back. But then you look at how many times can this be done?
Right. This is their third or fifth time.
When do you have to take personal responsibility to change your life? And that is one of the things I think that we're going to cover today with Trisha. What programs are in place in the communities? What things are there for people to take advantage of?
Yeah, all the resources. And are those available to people, or do they have to go through the court system or the hospital system to get it?
And it just depends on what level of commitment to getting sober and clean that people have.
Right. That's the first thing, is to want to get away from it.
And
you can't be forced away from it.
No, you cannot. And I hear all the time from family members that I'm seeing their family member in the office. What can I do to make them get clean? You cannot make them get clean. If they don't want to do it, they're not going to do it. And no matter how many times you may have a parent pay for somebody to go through rehab, or they, if they don't want to do it, it's not going to happen.
Right.
You've got to want to do it.
Right.
But all we can do is let people know about what resources we have available, what's there for families, and go from there. Okay.
Okay. Now give us all the answers.
Yeah. No pressure, Trisha.
Well, first of all, thank you guys for having me today.
Thank you for coming.
I appreciate the invitation. So drug addiction in our community is a huge problem. So I work mainly with inmates in Gallia, Jackson, and Meigs in the local community jails. We see, I think probably 95, almost to 100% of the time, they have addiction issues. Of course, opiates is a huge issue in our area, as it is across the nation. And I agree with Sherry, the stats, it's really bad in the Portsmouth area. But we're also seeing alcohol use. It's something you can buy in a gas
It's a
station.
legal drug.
Yeah, it's. I researched some statistics through the Ohio Department of Mental Health and Addiction Services. It's the most abused substance in our area.
What do you think about, it may be a little controversial, about marijuana? Is it the gateway drug, or do you have problems with people being addicted to that, or is it just pills and heroin and that sort of thing?
So obviously, as a drug addiction counselor, I have to be against marijuana. Research does find that it is the gateway drug, and I
Right.
found that in my practice as well. Yeah.
I guess the thing about maybe doing something illegal, that's fine with me, and so that opens the door, other things are fine too?
Yeah, and a lot of times people start out with marijuana, maybe as teenagers in high school or college, and then, you know, that high isn't good enough anymore, so they start experimenting with other things.
And I think that's something I've heard over and over again as well, because I see patients. I work for Woodland Centers as well, and I see them. I do the medication management, and that's what I see too. People will say, they'll say, I'm always chasing that first high, and they never get back to that first high, and it always and what you see a lot of, and as Trisha and I have worked together, you know. I'll see the jail inmates and things for Gallia County, and what happens is they are masking whatever their underlying problem is, whether it be bipolar disorder, depression, anxiety, PTSD. You know, they've had an abusive childhood, they've had traumas in their life, and people are self-medicating, and that's what they do. They medicate that feeling to try to get rid of that instead of dealing with it in an appropriate way with counseling and you know, if they need medications for bipolar or depression or anxiety, whatever they need to medicate, instead they're using these substances. And then when you get them into treatment, you have to dig through the substance abuse to get to the underlying issue that they were self-medicating in the first place.
Right.
And it's very difficult digging through that once the substance addiction has occurred.
Absolutely. And most of us, we know that things worthwhile take time. With people who are struggling with addiction, they want instant results, and that's why a lot of times they turn to substances. Instead of going through months of counseling, they just want to take a pill or use a needle to
I
deal
think
with their
most
problems.
of the population is like that. You know, I've got this hurt, I've got this problem, can I just take a pill and make it go away?
Yes. Life isn't always that simple.
No.
No. And I think we've become a society. It's very much give me something to make me feel better now.
Right.
And instead of saying, you know, we're going to start you on this medicine, but it's going to be 3 to 4 weeks before you start to see some effects. I want something that makes me feel better now.
Right.
You know,
Like old people, it's like, you know, I hurt here. It's like, well, you're old.
That's a good answer.
Yeah. But it does.
Life is not pain-free, I'm sorry.
Yes.
But there's a behavioral component to addiction
Right.
too.
Yes.
There's the process of using that becomes almost, you know, I don't know the right word, but almost like a ritual to
Right.
them.
Well,
So
just
that-
like
that
a person
becomes-
with cigarettes, whenever I get up or whenever after you eat, then you got to have a cigarette. It's just one of those habits.
Absolutely. So that's
Okay.
something that needs treated as well.
Mm-hmm.
There's all kinds of triggers. It could be the time of day, like you mentioned. It could be seeing a certain person. There's a ton that goes into counseling people with addiction.
And there's probably people with that personality type, right?
I
Or
don't.
would you say that?
No, I
No.
don't really know. I hear people say I have an addictive type of personality. I don't know that any research or studies really back that up.
What do you think about the genetic component for addictive type of behaviors?
Yes, research does point to that there's a genetic component, especially with alcohol use disorder. That typically does run in families a lot of times.
And what's been your experience, Trisha, that you are seeing that gets people to the point where they are ready to make that change? They're ready for to get sober, to get clean, to make the changes, to get into counseling. What kind of things are you seeing in our community?
Is it like a traumatic event where somebody died and that goes, okay, that's enough?
a lot of times, and like you said at the beginning, you have to want it for yourself. Family members can't make them want to start treatment. A lot of times it does take a significant crisis or a trauma. We typically say in the counseling community they've hit rock bottom. So it really takes some kind of significant event, typically, for people to say, okay, it's time to make a change.
Yeah, I've talked to a few people. It's like I have to hit bottom. It's like, do you know where the bottom is? That is no fun. And you do counseling in the jail, right?
Yes,
It's like you would think that's the place, and sometimes that isn't either.
exactly. I know for me, I like to put myself in my client's shoes, whether it be inmates or people I'm seeing on an outpatient basis. So I guess if I was in jail, to me that would be a crisis, and
Yeah, I
would
gotta do something about this
There
now.
couldn't be anything worse than being in jail.
Right.
But and that also makes it difficult for counselors because rock bottom is different for every person. That's why there is no one thing that we can tell people that's going to work.
So what is your place? What do you do? Are you a counselor? Do you prescribe things, or what are your tools?
Unfortunately, I'm not licensed to prescribe things. I'm a licensed professional counselor and a licensed independent chemical dependency counselor. So I'm licensed in the state of Ohio to provide cognitive, behavioral type of interventions to help people in mental health and addiction.
So how long have you been working?
About 5 years in the field.
Okay, so of these 5 years, what's the percentage of successes?
Very small.
Yeah.
Again, it goes back to people's willingness to commit to treatment. A lot of times they might come into treatment and not like our rules, decide that, they're just not ready. It could be various reasons. I think generally the national average of success is probably in the 20 to 30 mark across the board.
What kind of resources do you find that we have in the area for families? I know that's a big concern. Families are very, very frustrated. We have grandparents raising grandchildren. We have people coming out of in and out of rehabs, in and out of families' lives. They'll disappear when they're not doing well, and then come back, and and everyone wants to see them do well, and they bring them in. But what kind of resources are available? Are you finding in our areas for families to give them the tools they need to deal with these people?
Unfortunately, I think that that's been one of those gaps in the community. I am not aware of any resources in the community as far as families other than to participate in counseling process for themselves. Again, there's a lot of family dynamic issues that come into play with addiction. Codependency, enmeshment, enabling are all common terms that we use in addiction counseling. In Gallia County, there's the Citizens for Prevention and Recovery. They want to make that a community involved effort, and families of people in addiction, that would be a great place to start. Also, Woodlands is well prepared to deal with the counseling process involved in families of people who have addiction problems. But I think that is a good topic for the community, myself included, to begin talking about, because I think that, again, that's been a big gap in services. So family plays such a huge role.
Absolutely.
Social support is a big component of recovery.
And if they're not supportive, and you go back home as an addict, and then they treat you in another way, that may just send you right back.
Exactly. It can
And that
cause
probably
relapse.
happens more often than not.
It does.
Yeah.
Absolutely.
So, I just forgot.
It's-
Why do you talk to people? Is it because they ask you to, or because the court or somebody is ordering you to, or that person to talk to you?
Both. We have more success at Woodland Centers in our addiction program for people who are court ordered, just because the court really enforces their attendance. We do take walk-in self-referrals, and that's great that they're at a place that they're willing to accept it on their own. So both. I deal with courts and just general population that come in.
In the jail, is that a mandatory thing?
No, the jails, the inmates have a choice in whether or not they want to participate in treatment.
Okay.
And I think it's really nice that that our county jail, and I know we work with Jackson County Jail at Woodland Centers as well.
And Meigs County as
and
well.
Meigs County, that they are recognizing that these people are, they have broken the law, they are in jail. but there's also a mental health component to their treatment. And if that can be addressed, that they are more likely to be successful.
Is that an or thing, whether you get treatment here or we send you farther up the road to a prison?
In the jail system, no. Typically, there's no consequence for not participating in
Okay.
treatment. But I think Woodland Center's mental health, addiction counseling, and law enforcement have come a long way together. Since the 1950s, we saw the deinstitutionalization movement where asylums around the state closed. So now jails and prisons are the new asylums, per se. So we're dealing with mental health crisis. We're dealing with addiction in the jails because that's where they typically end up.
Right.
So I'm really trying to educate law enforcement on the benefits of treatment. I've met with several area judges trying to incorporate treatment into plea agreements and sentencing. So I'm having really great success there.
Good.
And I think I think that is the key thing too, is bringing everybody together in the community. I know at Woodland Centers we do have an inpatient unit. 3 of those 13
Yes.
beds are strictly reserved for opioid dependency, and that is something new. So that's a treatment option in the community. There is a Cardinal rehab. They've got a place in Spring Valley, and it is a 14-bed male unit, I believe, and it is a 6-month program. Queen Treatment Center in Jackson is a women's-only program, and I think they have 6 or 8 beds. There's Ed's Place, also
Right.
somewhere up on the edge of Jackson County.
So you say they have beds. What's the treatment? Do you stay there locked down for a certain amount of time, or what's the idea
it
of
depends, I
staying
believe, don't you think, Trisha, on the program and how the program is set up and what its regulations are. Most of them are very structured. They offer counseling, very individualized to your diagnosis. They offer a lot of coping skills groups. You know, you can get people clean if they're, you know, in a situation, whether it be jail or it be they're locked up somewhere or whatever.
They're out of that
But the
environment
thing
that
is
triggers.
you have to help them achieve the coping skills necessary to maintain that.
So
in?
when
And
they
it's hard
go
to
back,
tell somebody, say bye to all your friends that you've known, who
Well,
are the pushers.
And that is, I think that's one thing you truly see. It's you can't go back into that environment and expect to maintain sobriety. And I think another thing that is a huge problem that we are seeing in this area, and I think Trisha will probably agree, we've discussed it in the past, Suboxone can be very controversial as well. I have heard people in the medical community say it's a great thing. It allows people to work and have a life. And the reality of the practice that I have seen is I have not found anybody that I've talked to, and people are very honest when you're talking to them in an office setting and you're treating them and you're trying to prescribe medications for them and determine what the problem is. You know, and they'll tell you, yeah, I go to Columbus or wherever and get my Suboxone. It's incredibly expensive. But what you're finding is they're doing is they may use some of it, but the majority of the people, well, actually everybody I've talked to, say for example the Suboxone strips, they'll strip out part of it. They're using part of it enough to keep
Take
things
the
at an
edge
edge,
off.
and then they're selling the rest, and that is it's an income. But what they're also doing is they're also abusing other drugs. And then when you get into the Suboxone and they're using other drugs, you get a combination, say it would be alcohol or benzos, the Valium, Xanax, Ativan, Klonopin, any of that, and you can very easily overdose. And then we are also seeing a huge thing with heroin, and I'm sure it's nationwide, but they're mixing it with fentanyl. And it is, and fentanyl is a very powerful medicine that you usually see used in like anesthesia or like in an OR setting, things like that. So, and I remember when the Columbus Dispatch ran an article here a while back about that, and I'm like, where in the world are these people getting fentanyl? How is, where's it coming from? And apparently it's, a lot of it was coming from China, according to the article they did.
They
And,
make the best stuff.
Apparently so.
I know their
It's,
regulations are very strict.
They must
on
be, but it is insane because what you'll see is, and that's what you'll see a lot of times. And I know we've had it happen a couple times in this area. We've seen it happen in Huntington, and I think Cincy also
Yes.
here not too awful long ago. They'll have huge they'll have like an ungodly amount of overdoses in just a few days. And I
Because they
think,
get a hold of a bad batch.
well, and you know what's really sad? And I worked substance abuse. I worked with a lot of guys with substance abuse issues in the VA setting as well. And what you're seeing is they will tell you when, and you would think if you know you've got a bunch of people dying from a heroin overdoses that people would stay away from it. That's not the case at all. It's like, oh wow, this is really strong stuff. Where are they getting it at? And they want to use it.
I want to get as close to the edge as possible.
And it just,
But-
but you know, that speaks to how addiction affects people's brains and their decision-making skills, and what becomes important to them, and what doesn't.
Yeah, I was on the grand jury, so we saw not just one case, but you know, we were on that for like 3 months. So we saw, I don't know, 20, 25 cases every time we went in, and like I say, 95% of the cases had to do something with drugs. Either you stole for drugs, or you're dealing drugs, you're using drugs. It was all about that. But you know, one of the people on the jury said, what are these people thinking? Because a rational person
not
looking
thinking.
in goes, that doesn't make sense. Well, it changes your thought process. They
Yes.
don't think
Think.
like we do.
No.
And that's why there's a disease model of addiction, because there's a huge physical component of how substances affect the brain. These are foreign substances to the human body that's we're not meant to have in our body, like heroin coming from Mexico or China. Who knows what's in that? So
Not to mention what we know is in meth.
exactly,
You know,
who knows?
who wants to put that stuff in you?
Exactly.
Well, and it is, you know, the fact that, you know, you can see these people and what it does to their bodies, and it, you know, it's, why would anybody choose to do that? But I think we're creating a whole generation of children that are going to be growing up without parents. We're just seeing so much with the overdoses and the deaths, and like I said, you know, grandparents raising children in foster care. What kind of resources are you seeing available, Trisha, locally for children that are a result of this epidemic that we're having?
Again, I think schools are doing a really good job. I know several treatment providers, Woodlands, Hopewell Health, are going into the schools to provide counseling to children. All the local schools, to my knowledge, also have school psychologists or school counselors that are always there to assist kids in processing and trying to develop coping skills. Being a kid in today's day and age is really tough.
It is.
It really is.
It is.
And I know from having been in some situations, not necessarily drugs, but different situations, when, you know, it would be hard to self-identify, because when you have a life of this, you think everybody else is having that same thing. You know,
Exactly.
if I'm having a happy life, then when you drive past the houses down the road, oh, everybody's happy, right? Or if you have a very troubled life, then you think, well, that's just the way it is. Everybody's doing it.
Absolutely. That was one thing that was hard for me when I first became a counselor. I had to come to the hard realization, not everyone thinks like I do.
Right.
So that's kind of something to keep in the front of your mind, or, you know, when you're out in your daily activities, think, like, who could I reach out to today?
Absolutely, and I think it's important too to, you know, talk to your children. They, you know, they are going to school with kids, and they may have no idea what's going on in their world. They may not realize that the kid they're, you know, that's coming to school with dirty clothes on and that other kids are making fun of, that they don't have any water, that they don't have electric, that there's not food in the house. So I think it's important that we start young talking to our children, and that kind of crosses over, and we talked earlier about the bullying thing as well. But you know, if your child is living in a home where they have all their needs being met, they don't understand what that means to other children.
Right.
Exactly. So yeah, just reach out. There's help available. Talk to the school, your teachers, principals, social workers at the school. There's a lot of resources for children in the area.
And I would imagine if you're a teacher, then it's your responsibility, if you hear something, that you have to point them in that direction.
Absolutely, and you know, and I would really, honestly, I would really hate to be a children's services worker, and thank goodness for them. But that would just be a tough field to be into, dealing with these children that did not choose to be put in this situation.
Right, and trying to break that cycle.
Absolutely, and that's where you know, treatment is so imperative. Is, you know, it's got to stop somewhere. But where does it stop, and how do we make it stop? And like so, you know, we talked for you can't make anybody do anything, but give them the resources, give their families the resources, put the things in place, but when they're ready for help, they will make that choice to do that.
And that's a good point, because there's a social learning theory component to addiction too. So kids brought up in the home where addiction is common, that's normal to them.
Right.
So then they grow up and continue that cycle. So we
Absolutely.
definitely want to break that cycle.
Or there's abuse in the home as a result of it, and now they're medicating because of that.
Exactly.
Yeah. And that's what I think I've seen in practice, is that people always have a reason for starting to use. It was, I was depressed, I was anxious, I was abused, and those are all horrible things to have dealt with. But, and that's the thing, is giving people those skills they need, those coping skills they need to find alternative ways to deal with it that are more healthy and that are not going to create these addictions and continue the cycle.
It's a tough one. The answers are not
Yes.
plain and easy, and it's could be a lots of different things.
Yeah.
It is, but
It's a very individualized issue, so.
Okay, well, thanks for watching. Hope you may have found some resources you didn't know about, and we'll see you next month on Body
Thank you.
Talk.
thank you.